My name is Stacey Doran. I'm from Jones Clinical Group. I have a physician's order to place a peripheral IV catheter with extension set for 1,000 milliliters of normal saline to infuse over 10 hours for patient Kelly Williamson. I'll enter the room, hand hygiene. Hi, Mrs. Williamson. My name is Stacey. I'm going to be your nurse today. I have an order from your doctor to place an IV to pump some fluids into you. Have you ever had one of those before? No? Okay, well with the needle, I'm just going to place a flexible cannula into your vein to pump some normal saline fluid to rehydrate you, and that should make you feel a lot better, okay? Can I just take a look at your wristband real quick? Okay, can you tell me your name and date of birth? Okay, Kelly Williamson, 1/1/1957, and your allergies, betadine and iodine, okay? Alright, I'm going to do hand hygiene and collect my supplies. Okay, I have my normal saline. I'm going to check it with my order, 1,000 milliliters. Alright, and it's not expired. Check my primary tubing, it's intact. An extension set, not expired. My IV start kit is not expired.
So I'm
Okay,
going to go ahead
and my
and
catheter.
prepare my
Okay, first I'm going to open my primary tubing. Pull it out. Check that my roller clamp is closed.
I do this also. If I were to touch any of the ports, then I would start over in real life.
I'm going to open my bag, keeping both ends sterile, and spike the bag.
By flushing it with the normal saline.
And I'll hang my fluid.
Okay, so flush that.
I'm going to prime my tubing by slowly opening this clamp
Okay. Go ahead and set that aside.
into the trash can.
Next, I'm gonna go ahead and get ready my IV starter kit as well as
Squeeze
my
my
IV
drip
catheter.
chamber to fill
So
that
I checked
halfway.
everything in the beginning. So go ahead and place everything where you need it.
Okay, I'm going to let it prime. Make sure there's no bubbles. Okay, there's no bubbles, so I'm going to close this
Open this for now.
and just place this in reach for me. Alright, next I'll open my extension set, which was not expired.
Okay, at this time, I'm going to go ahead and wrap this around her arm. That way I can
And
find
attach
an
it to the syringe.
Okay, Mrs. Williamson, we're going to go ahead and wrap this around
Also
her arm
keeping
and
both ends
fix
sterile.
for a moment.
Place this on here. And I'm also going to prime this one.
So at this time, I'm going to try to search for an accessible vein. So I found an accessible vein, and I'll be using the medium
Okay.
pivotal vein.
This one's primed, so I'll leave it right here in reach. Next, I'll open my IV start kit.
So I'm going to go ahead and wash my hands and put on some gloves. That way you can get ready for the function.
Set up my supplies. Okay. Get my tourniquet out.
Okay.
Okay, I'm just going to put this tourniquet on your arm
So
to
now
find
I'm
a
going to go
vein.
ahead and clean the insertion site with an antiseptic. So I'm going to go ahead and rub that on the skin just enough to where it will be able
Okay, I'm going to palpate for an accessible vein. Okay, this one feels good. I release the tourniquet. Hand hygiene. Put on gloves.
So now I'm going to let that dry. Now it's drying, I'm going to go ahead and replace this tourniquet. Okay, Mrs. Lewis, I'm going to retie this. Okay. So now that I got all that, I'm going to go ahead and get ready for my acupuncture.
Okay, I'm going to clean the area. Put my antiseptic solution on my insertion site for 30 seconds
My index finger
and allow it to dry.
I'm going to place it above and below the vein that I want to
And replace my
puncture.
tourniquet.
And I'm going to stretch the skin distal from the insertion site. I'm going to insert the needle at a 10 to
Yeah, open
30
my
degree
catheter.
angle and watch for blood return. Alright, Mrs. Williams, I'm going to go ahead and insert the needle now, okay? So you're going to feel a prick.
I'm going going to stretch distally at the vein
Stay still as much as
to hold it
possible.
still.
Just take deep breaths if you need to.
Bevel up. Alright, Miss Williamson, on the count of 3, I'm going to insert this, okay? You're going to feel a little poke. I'm going in at a 10 to 30 degree angle.
Okay, so I see
Insert
blood
until I
return.
see
So
flashback.
at this moment, I'm going to go ahead and advance my hub to the insertion site.
Okay, I see flashback. So I'm
So
going to
now-
continue
so that's
pushing
stabilizing.
my hub to the insertion site and pull back on the needle.
I'm going to grab my
Okay,
extension
and I'll release my
set.
tourniquet.
I'm going to flip this off. Maintaining sterile
And I'm going to get my extension
I'm
set.
going to start over because I
Move the cap, keeping the end sterile.
So now I'm going to go
Remove
ahead
this.
and
Style it.
remove the style it.
This on here.
And I'm going to connect the extension to the hub.
Okay.
Maintaining
I'm going to
sterile
hold this and I'm going to flush the area. Check for patency. Okay. And I see no swelling around the insertion site.
Okay.
I'll close this.
So now I'm going to go
Sorry.
ahead and flush the extension
Okay.
set.
Right. I'm
Okay.
going to tape
And
down.
at this moment, I'm going to go ahead and check for any swelling at the insertion site, just so it indicates infiltration. There's no swelling, so no infiltration at this time.
I'm going to place this clear tape over my hub so I can see the insertion site still.
Okay, now I'm going to go ahead and
I'll
place
leave
my
that there.
Tegaderm on the hub, but not on the
Okay.
connection itself.
I'm going to tape down here also. Okay, I'm just going to secure this to your arm down here. Okay. Right now, I'm going to get my primary tubing. Close this so I don't get any blood return. I'm going to remove this from the
I'm going to go ahead and take this
normal saline lock.
stability.
Remove my cap from my primary tubing. Keeping both ends sterile. And attach this. Okay.
Alright.
I'll open this end, keeping the primary one locked.
Take this out from under you.
Come over here and
Okay, now I'm going to go ahead and connect my primary tubing to my extension.
place this in here.
So grab this. Make sure that's coming.
Loop the tubing through here.
Okay. So now I'm using the sterile technique. I'm going to go ahead and connect it to, if I do accidentally touch the port site,
Now turn this on and set my flow rate. Since it's 1,000 over 10 hours, do 100 milliliters per hour. We're the whole 1,000 milliliters.
Okay.
I'll make sure this is open, unlock, and
Okay, so
start.
next thing I'm going to want to do is I'm going to want to load my primary set into the air.
It says there's air in the tubing. This is where I would check it. But there are no bubbles.
I'm going to insert the safety pin.
Okay. And I would solve that problem. Okay. Okay. I'm going to come over here and I will get my documented label with the date and time and my initials and place it on my primary tubing. And then my date and time and initials placed on my insertion site. I'll clean everything up. Put this in the sharps container.
So I'm going to set my rate to 100 mils per hour. And
I'm going to remove my gloves.
1,000 mils of fume.
Hand hygiene. Alright, Mrs. Williamson,
Play with this.
you should be able to move freely. Just use caution when you're bending to avoid any tugging and pulling. Okay, if you need any assistance, I'll be right nearby.